Good afternoon, and thank you for joining us for an MP webinar covering 2022 ACA reporting, key updates, and best practices. I'm Katie Crater, Marketing Specialist here at MP. For those of you joining us on a webinar for the first time, MP is a full-service human capital management company. We offer a complete suite of products and services to support organizations through the entire employee lifecycle, including recruiting, HR, payroll, benefits administration, time and attendance, and compliance assistance. We support our clients with cutting-edge technical solutions, as well as proactive, reliable service and a deep HR and payroll expertise. At MP, we are wired for HR and help our clients succeed by aligning their people strategy with their business goals. I'm excited to introduce your presenter for today's program, Paul Carelis. Paul has over a decade of experience in the HR consulting space. Working with businesses of all sizes and industries, Paul leads a team of SHRM-certified HR professionals at MP. Together, they assist clients with compliance, training, and HR guidance and support for the full employee lifecycle. Paul also spearheads MP's employee retention tax credit services. This initiative has helped thousands of clients claim over $100 million in refundable, advanceable tax credits. And just a few housekeeping issues before we get started here today. If you would like to submit a question during the program, please use the Q&A feature at the bottom of the screen. We will be sending out the recording of the webinar later today, along with the presentation and slides. To ensure that your company is prepared for year-end, I'm going to drop a link into the chat for you to book a meeting with an HR professional. And with all of that, I'm going to hand the mic off to Paul.
Thank you so much, Katie. Welcome, everybody. Really looking forward to discussing this topic today. ACA is something that many of us, myself included, have kind of put up in the attic for the summer and allowed it to collect dust, but that time of year is in front of us again here, so you got to dust off the ACA, start flexing those muscles again, and start talking about it. If you are a business that's been subject to the ACA in years past, some slight changes, nothing too major this time around. Just some tweaks to some of the penalty amounts and the affordability percentages and all of that, but largely status quo in terms of filing ACA this year versus last year and looking ahead to next year as well. That being said, there are a lot of businesses newly subject to the Affordable Care Act, so a lot of businesses, despite the pandemic, have been able to grow. In the last calendar year, grew past 50 full-time equivalent employees. Also a ton of activity with businesses merging and acquiring and all of that. So, you know, you get a couple of smaller companies that have 20 or 30 or 40 employees together and combine forces, and all of a sudden you're an applicable large employer, which we'll talk about now. So among the things that we'll cover today, whether ACA is new or old to you, we'll do a quick overview, give you a little bit of a history lesson, kind of where things stand now. We'll talk about the due dates, when things need to be filed, when things need to be provided to your employees. We will discuss potential penalties. It's something that, you know, it's important to be aware of and really speaks to the importance of doing this right. We'll talk about the biggest changes that have occurred. Again, some modifications to the affordability calculation, some changes to the penalty structures, as well as some new codes as of last year for certain types of health plans. We'll tell you what to do if you do unfortunately receive a penalty letter. It's not a time to panic. A lot of these go out and are nothing to really be too concerned about, but it is something to definitely take seriously. We'll also take a look at the ACA reports. So in terms of the tax forms that are filed, the forms that are provided to your full-time employees, as well as if you are someone who utilizes iSolve, just a really quick look at what the reports are that are available to you to kind of help you manage your ACA process. And as always, we will pause and take time for any questions that you may have. We'll do our best to answer them. Obviously, something that's as beastly as the Affordable Care Act might require us to put some of those questions in a parking lot and research them, but we will send a complete response to any and all questions as soon as possible. All right, so let's dig in here. So again, just a kind of quick history lesson. The Affordable Care Act, in terms of its inception, dates back to March of 2010. As you likely have heard, there were numerous challenges by states and other entities really questioning the legality and constitutionality of the Affordable Care Act. Those cases on 3 occasions rose to the level of the United States Supreme Court. Supreme Court largely upheld the ACA all 3 times in 2012, 2015, and most recently in 2021. When it first rolled out, it was rolled out gradually. So, in speaking with and working with some businesses were originally subject to the ACA, and then either because of the pandemic or other downturns, their employee count fell below a number where they had to file, and now they're back up, so they're looking at this again. So if it's been a while since you've been subject to the ACA, or since you've worked with a business that's had to comply with the ACA, if it was a while back, there were some things that were gradually introduced and gradually rolled out and gradually became more strict over time. So the first thing that they addressed with the ACA was guaranteed coverage, whether or not people have pre-existing conditions. So insurance carriers can no longer exclude folks who have a pre-existing condition from obtaining health insurance. It also guarantees coverage for dependent children of eligible employees and other insurance eligible folks up to age 26. Also, one of the things people don't realize that was a result of the Affordable Care Act were a law requiring lactation breaks for nursing mothers. So that's an area where ACA intersects with employment law. If you don't already, you should have a lactation break policy in your employee handbook. It also eliminated lifetime coverage limits. So no longer can a company say, hey, we've paid X number in insurance costs to you as a member, and we're kicking you off the plan because of it. It also guaranteed pre-preventative care. So your annual visit with your primary care physician, your annual routine screening, some other preventative screenings should be no cost, either out of pocket as a deductible or a copay or anything. They should be completely no cost. And also created a rule which also infected employers in terms of their practices in eliminating waiting periods that go beyond 90 days from the date of hire or date of eligibility. So if you hire someone as a full-time employee and you're subject to the ACA, their waiting period to get on the coverage should not exceed 90 days. One other quick note, during the Trump administration back in 2018, they did repeal the individual mandate. So what that means is that as an employee, at least at the federal level, if an employee decides not to carry health insurance for themselves, there is no penalty to them individually on their taxes. There are some states, Massachusetts where I sit included, that has a separate state rule where there is a tax penalty for individuals who do not have adequate health insurance, but at the federal level that has been repealed. So in terms of how things have changed over the last couple of years and updates to the Affordable Care Act, as it's something that the IRS has been keeping a close eye on, they have increased the penalties for both the non-offer penalty as well as the affordability penalty, and we'll go into those in detail in a second and go over some examples. So it's kind of been a step up where each year they've gradually increased them a little bit. And that includes this year, and it also includes an increase for the 2023 calendar year as well. They've made several announcements. I don't know how foreboding it is that what they consider good faith efforts, which were kind of baked into the original first several years of the ACA, where they kind of gave people a break if they made a mistake on their filings or missed somebody or something went awry. There was some kind of forgiveness for a good faith effort in trying to comply. They've said, hey, this law has been around for more than a decade now. Businesses need to get with it. They need to be compliant. They need to follow the rules. So we haven't seen it too much in practice yet in terms of penalties and how those have been treated and abated or not abated. But according to what they're saying in press releases and all of that, they're saying that the good faith olive branch is no longer. One bit of good news for employers, though, is that if you've been subject to the ACA for a while, you'll know that they'll always say, hey, the due date to file is January, the due date to file is January, and then we get into usually December around this time, and everyone's sweating and panicking and trying to have everything ready in time, just for the government every single year to extend the deadline to February or March. So one nice thing the IRS did do is permanently move back the due date to March. So we'll go over the due dates also in a moment. All right, so before we dig in and before I drown you all in any sort of lingo and acronyms, and I'll try to avoid it, but sometimes I can't help myself, I did want to go over some of the key terms when it comes to the ACA, just so we're all hopefully speaking the same language. So the first is an ALE, which I might throw around. That stands for applicable large employer. So basically, anyone who is of an employee count size that they have to comply with the ACA, the term for those businesses are ALEs, or applicable large employers. They are subject to the ACA employer mandate. The way that you become an ALE is by having 50 or more full-time equivalents in the previous calendar year. So in order for you to be an ALE this year in 2022 and have to have been in compliance with the ACA this year in 2022 and have to do your filings and have them filed by March of 2023, is that in 2021, on a month-by-month and averaged out, your full-time equivalent count had to have been 50 or higher. And we'll get into that calculation momentarily. When we talk about 50 or more full-time equivalents, what that means, and it can be different for every program. First, you count anyone who works 30 or more hours per week as a full-time employee. The full-time definition under ACA is 30 or more hours per week. And why we say equivalent is because you also have to add up the people that fall below that and add them together and divide it and do all that fun math and come up with your actual FTE count. So the way you go about doing that is add up all those full-timers, they all count as one, then add up all the hours of the other folks and divide and come up with your number. So in the most simplest terms, a 30-hour employee a week is a full-timer. 2 15-hour employees per week count as one full-time equivalent. So that adds to your number in terms of FTEs, but just know that in terms of who you have to offer coverage to and who you have to furnish 1095-C forms to be compliant with this, that's only the actual full-time workers, the actual 30 or more hours per week folks. There is also this term of a variable hour employee, and this happens more and more, especially with so much uncertainty and flexible scheduling and all of that. If you hire someone, and it's important you do this in good faith and you don't do it in a way that's abusing the rules and trying to skirt your obligations, but if you hire someone not necessarily as a full-time and not necessarily as a fixed schedule part-time, but kind of say, hey, we don't really know what the schedule is going to look like. There might be some weeks where you're at 30 or over 30. There might be some weeks where you are below 30. You're truly a variable hour employee. We don't kind of know where to peg you. If that's the case, you have up to 12 months to take a look at the actual hours worked and make a determination in terms of whether or not that employee is full-time and whether or not they have to be offered insurance. So that whole 90-day waiting period maximum, if you truly have a variable hour employee, you're afforded more time to make that determination. All right, so some more key terms that you'll hear. First is the measurement or the look-back period. So I'd say many of the employers we work with use the 12-month look back. So you're basically at open enrollment time, looking back to the previous 12 months, seeing how many hours everyone worked to determine who's going to be eligible for the benefit. You do have the option of doing a much smaller time period. There's a monthly measurement that you can do 3 months, 6 months, 9 months. For some industries, those work well. But essentially you are re-examining eligibility at that frequency. So very administratively burdensome. The caveat is if someone qualifies, and this is where the stability period comes in, if someone qualifies, say, based on a 6-month look back, regardless of how their work fluctuates in the following 6 months, they're in a stability period, so you have to guarantee them insurance for the next 6 months. So there's pros and cons to each method, and certainly if you work with us or would like to work with us, we can discuss that in greater detail, as every situation is different, every industry is different. You've got seasonal employers, seasonal employees, all of that can really factor into the best strategy, but there are some options at the end of the day. The administrative period is basically your time between the measurement or the look back period and the stability period, where you're kind of doing your measurements, determining who's eligible, making those offers of coverage, doing your open enrollment, and getting people signed up. So in our example here, for a couple years ago, a 12-month look-back period by this sample company was January 1st to December 31st of 2019. They then gave themselves the month of January as the administrative period, and then benefits were effective for those folks determined full-time from February of the following year until the end of January. So the 12-month stability period then immediately followed. And then finally, some other things you may hear, especially when it comes to what triggers penalties, would be the exchange or the marketplace. And that can vary depending on where your business is and where your employees work from. So for some states do not have their own health insurance exchange set up. In those cases, your employees would go to healthcare.gov. Really, any employee can go to healthcare.gov, and based on the information they provide and where they live, if there is a state exchange, it will shoot them over to there. If there isn't, then it'll continue them on the federal healthcare exchange. Again, where I sit, the exchange in Massachusetts is known as the Massachusetts Health Connector. Several other states also have similar programs, but it's just important to understand that these exchanges exist. They're in place for employees who either lose coverage or during the state or federal open enrollment period. Employees can go in there, depending on their income and some other factors, may qualify for subsidies on health insurance if they take it from there. All right, so at the highest level, what are your requirements as an employer when it comes to being compliant with the ACA? First of which is, if you are subject, if you're an ALE, you need to offer coverage to at least 95% of eligible employees. So whatever your measurement period is, or whatever your look back period is, whoever is determined full-time during that time frame, you need to be able to show and prove, if challenged, that you offered coverage to at least 95% of those full-time individuals. So that's kind of the offer of coverage obligation. Second is the affordability. The employee share of the qualifying lowest cost employee-only plan must not exceed 9.83% of their household income. So that's a number that's ticking down as we go on. And we'll show that on I believe it's on the next slide, how that's ticking down. So basically that's meaning that employees are required to pay less and less of the insurance, or a smaller cost, for it to be affordable. So that can be a challenge depending on your plan design. And aside from these two bullets, the other requirement is that you file paperwork both with the federal government as well as providing a form to the employees to show that you complied with bullets 1 and 2. In terms of the due dates, so this is for the 2022 plan year, you must furnish 1095-C forms to your employees by March 2nd, 2023. There are a couple states, namely California and Rhode Island, that still require it by January 31st. So if you have employees in California or in Rhode Island, technically speaking, they need to be furnished their 1095-Cs by January 31st. If you are a paper filer, if you're in-house, if you have under 250, I believe it is, employees, and you're allowed to file on paper with the IRS, your deadline for filing your 1094 and 1095-Cs with the IRS is February 28th. If you're an electronic filer, so if you're a client of MP or other major payroll providers, you're most likely an electronic filer. The due date for those businesses is March 31st, 2023. If for some reason you're really struggling, you're not working with a provider, or you're not getting the ACA help you need, and it's become a manual process, and you're going to extend past these deadlines, you're going to want to seek out Form 8809. That is the form to request an extension for your ACA filings with the IRS. I highly recommend you do so if you're running in danger of exceeding these due dates here on the screen. For those of you who are MP clients and using us for payroll and ACA compliance. We ask that you please approve your forms by January 16th. That will ensure that you have the forms in time if you do have California and Rhode Island employees, and absolutely no later than February 6th, so that we can guarantee that your 1095Cs that you need to furnish to your employees are in hand by March 2nd for the due date. All right, so let's talk about the not fun stuff, the potential penalties that you could be facing. So if it's found that you did not offer coverage to at least 95% of your eligible employees, the non-offer penalty is based on your entire workforce. The way that the penalty is triggered, so you could be in violation of this, and if employees still sign up for your plan or don't get insurance elsewhere, there wouldn't necessarily be anything to trigger the penalty. The way that the penalty is triggered is that it just takes one, but one of your employees goes on to the federal or the state healthcare exchange, puts in their information, and signs up for health insurance there and receives a subsidy. And because of some reforms to the healthcare laws, it's very likely that many more employees than previously do qualify for some level of subsidy. It only takes, $1 of subsidy to their health insurance premiums to trigger this. But if an employee goes to an exchange and receives some level of subsidized coverage, that then potentially triggers the penalties. So for 2022, the penalty is $2,750 per full-time equivalent minus the first 30. So if we use the example of a 100 FTE company, their penalty would be based on 100 FTEs. Again, it just takes one to trigger this, minus the first 30. So you're left with a penalty responsibility for 70 FTEs times that 2,750 number. So the penalty for this sample 100 full-time equivalent employee company would be $192,500. So again, a fairly significant sum of money. You'll see here on the slide that the penalties are prorated on a monthly basis. So let's say you had new employees or something like that. They do prorate it to $229 per month. So if you're only in violation for a portion of that, then the penalty would be prorated accordingly. That 2,750 number is going to be going up next year to 2,880 or 240 monthly. So in terms of being in compliance in 2023, those will be the new potential penalties. Next is the affordability penalty, and this works somewhat the same, somewhat different. So it's similar in that it is activated when an employee goes to an exchange and gets subsidized coverage. The difference is that it's not based on the entire workforce. It's only based on the number of employees receiving a subsidy. So this would be triggered if it's found that your offer of coverage and the offer only has to be taken into consideration for the lowest cost plan and for the employee only level of coverage. So you don't have to worry about the cost of the family plan or adding kids or adding spouses. It's really the cost for the employee only coverage and their responsibility, how much they have to pay. If that's determined to be unaffordable and someone gets subsidies elsewhere, the penalty is $4,120 per employee receiving a subsidy. So in our same example of a 100 FTE company who had 4 FTEs that were not offered affordable coverage and received subsidies, in this case, their penalty would be 4 times that 4120 number, or $16,480. This number is also increasing in 2023 from 4120 to 4320, so it's going up $200 per affected employee next year. Okay, got a question here that I want to respond to before we get beyond it. If we offer health care but an employee goes to the exchange anyway, do we get penalized? So the answer is no. Your obligation is to offer coverage. what it's really, really, really important to do is that when you make that offer of coverage and the employees are declining it, that you get them to sign a waiver, whether that be electronically through an electronic onboarding system like iSolved, or even if it's on paper, that's fine. It's just really important that you have them sign a waiver, because part of the questioning that they'll get when they sign up for subsidized coverage is, did your employer make an affordable offer? And if they answered no to that and they get a subsidy, then they'll look that, you could get a letter inquiring and it might have some scary numbers on it. But if you can show that you made an offer, and then later, as we got another question or comment in here too, you do have to show that it was affordable, and we'll go over how to do that. But if you can prove that an offer was made and that offer was affordable for the employee only coverage, then that will alleviate you of any potential penalties. Good questions. One other question before we move on: is the penalty always annual, or do they prorate it per month? It is prorated, so the penalties are always prorated. Okay. So in addition to those penalties, if you do not comply with the filing requirements of the ACA, there are penalties for that. So if you file your forms late, there's a penalty of $280 per form. And remember, you're issuing 1095-Cs to all of your full-time employees, so that adds up quickly. That penalty maxes out at $3 million total. If they determine that you've intentionally failed to file, that you knew you had to do it and you just refused or ignored the law, the penalty is quite a bit steeper. It's $530 per form, and there's no cap to that. All right, so what do you do if you do get a penalty letter? So we've seen it happen before. We've had clients who came to us who weren't working with us because the IRS is quite a bit behind on these. They're catching up, but I mean, it's not out of the ordinary for now for you to receive one of these letters pertaining to 2020 or even 2019 in some cases. So it's not something where they send this out quickly. It will be a form letter 226J. First things first, do not panic. You will see it'll say, they can be worded in different ways, but basically it'll say, we feel that you may have been in violation of the Affordable Care Act. They will oftentimes put an assessed amount on there. It's going to probably be a very large number, 6 figures or more. It will require some qualification, and in many cases that I've worked on these, we've gotten them completely wiped away where $0 are owed. It just requires a bit of an explanation, but I wouldn't be too worried about the dollar figure. It's an assessed amount. It isn't necessarily based in fact. So again, don't panic with that, but also do not procrastinate. The window to respond to these is generally somewhat limited, so you do want to act quickly. You do not want to miss the response deadline, because things will get ugly at that point. First thing you want to do is reach out to your payroll provider for that time period. So whomever you were processing payroll with, or whoever was helping out with ACA during that time period. And then based on what the letter is alleging or asking about, you're going to want to access your records. So again, those waiver forms, if you hopefully have them, open enrollment data, you're going to want your payroll records if it's a matter of affordability, so you can show how much the employee was paid versus how much the employee-only insurance cost, etc. You'll then want to craft your response, either yourself or utilizing an HR professional or maybe even legal counsel, depending on the circumstances, to write a response. And then you send it off, and as is with many things with the IRS, as good as they do some things, they're not always the fastest. So make sure you meet their deadline, but don't hold your breath in terms of when you'll get a response back, but do keep your eyes peeled for it for sure. But again, just because you get one of these letters does not mean you are in violation, and does not necessarily mean you're going to owe any penalty, but it is important that you respond. Okay, so in terms of the information reporting requirements, businesses are required to provide 1094s and 1095s. So if your plan is fully insured, your insurance carrier takes care of what are known as the B forms. If you're self-insured, you're going to want to talk to whoever you work with for your self-insurance plan to confirm that they take care of the 1094 and 1095Bs. But in just about all cases, employers themselves are responsible for 1094 and 1095C. And why do we have to do these things? Government needs to determine that employees who are not eligible for subsidies, to make sure that they receive the subsidies that they should have and didn't receive any subsidies that they shouldn't have, and then also to confirm that applicable large employers are doing what they're supposed to be. A few more definitions that'll be pertinent here: minimum essential coverage and minimum value. So in addition to being affordable and meeting that requirement, your health insurance plan that you're offering and counting as that lowest cost option needs to meet minimum essential coverage, meaning it needs to cover the things that the ACA requires it to cover, the free preventative, no cost preventative care and screenings and so on and so forth. It also has to provide minimum value, meaning it needs to pay for at least 60% of covered benefits through the premiums. And then when it comes to affordability, again, that's been a sliding scale that we'll talk about. But there are 3 different ways that you can determine whether or not your plan is affordable. And you can mix and match. You don't have to have the same test for all workers. It can be different from worker to worker in your favor to be able to meet that affordability threshold. So the 3 options are W-2 wages, rate of pay, and the federal poverty level. So the W-2 one is pretty straightforward. You're basically taking the amount on the W-2 in box 1, so taxable wages. The measurement for this year is 9.61, so that's creeped down a little bit. So the affordability, you'd have to take a look at the wages that the employee was paid times 9.61%, and that and their obligation or the employee portion of that lowest cost employee-only health plan cannot exceed that amount. The rate of pay safe harbor is a little bit different. What you do in that sense is you take their hourly rate that they're paid, multiply it by 130, so that's the amount of full-time hours in a month based on ACA definitions. Multiply that number by 9.61%, and that gives you the maximum amount per month that an employee can have to contribute towards the lowest cost employee-only health plan for it to be considered affordable. In terms of the federal poverty line, that doesn't really have anything to do with the employee's wages or how much they're paid. But if you happen to have a plan where the employee's contribution for the EE-only coverage level happens to be below $103.14 per month, so that's probably going to mean you're paying a large share of the premium, or maybe paying all of the premium for your employees. If that's the case, then you qualify under the FPL safe harbor. One quick note, as you'll see on the bottom here, while the percentage of affordability is 9.61% this year, next year it's going to tick down to 9.12%. So that'll be your new calculation for complying with 2023. All right, so the 1095C form is something that often will trip employers up. It's confusing, it uses codes, it's not in English, completely understandable. So there are 3 parts to the 1095C. Let's break it down a little bit. Part 1 is the information about the employee and the employer. Part 2 talks about the offer of coverage that was made, and what the cost was, and whether it met affordability guidelines. And then Part 3 has to do with other covered individuals. So there have been some somewhat recent changes. I believe it was last year to the 1095 form. These things are new. The box kind of in the middle there towards the top, the employee's age on January 1st. That's a new piece. Also, the start month of the plan. So if you have a benefit renewal that is mid-year or something like that, that would be reflected there. And then the zip code is used if you're using independent coverage HRA. So those aren't common, but that is another option for employers to explore, where they provide a specially designed HRA plan that allows employees to go to market and get health insurance, but it's still ACA compliant. So these are important for the ICHRAs. Otherwise, you may see some of those blank, and that's okay. If you're wondering whether or not you offer an ICHRA, I'll tell you, you probably don't. It's a very unique plan design. It's not offering specific insurance plans to employees. It's pretty much putting some money into an account for them and letting them go get their own coverage. So again, it's some creativity with plan design. Definitely speak with your insurance broker if it's something you want to learn more about. They can be a great option in certain circumstances for sure. They do make 1095-C filing a bit of a pain in the butt, though, I'll tell you that. Okay, so to break this down, because this is the most confusing part of ACA filing and where you see these codes. So the codes on line 14 are going to show you whether or not an offer of coverage was made to the employee and what that offer looked like. Line 15 is going to show the affordability by showing what the cost for the lowest employee-only level of coverage was. And then line 16 is going to tell you either what safe harbor was used to make it affordable, if they didn't sign up for a coverage through you as the employer, or that they were on your plan. So that line 14 is going to display if they were offered coverage. It will say based on the code whether minimum essential coverage and minimum value was in play. It will show you which months of the year this coverage was offered to the employee and whether or not they were an eligible employee in that month. You're going to either see a number in each month, January through December, you'll see a code, or if there wasn't any changes, if this was a long-time employee who was eligible or not eligible all 12 months of the year, you may just see one code in that first all 12 months box. As Katie said, you're going to be receiving a copy of this presentation, a recording, as well as the slides. So I won't go too into detail on these codes, but you will have these sent to you so you can review them and certainly let us know if you have any questions. But this is kind of the key to the codes that you'll see in that line 14. 1A is a common one. You may also see 1H if there wasn't an offer made. There are these new ones you see highlighted in red here. So if you do have an individual coverage HRA, those are new codes as of last year, the 1L, 1M, and 1N. All right, line 15 is going to, again, not necessarily show the cost. Let's say you have an employee and I signed up for, you've got an HMO and a PPO, and I signed up for the more expensive PPO and I signed up for the family plan. What you won't see in that box is the amount that I have to pay under that plan. What you'll instead see is the cost of if I took the lowest cost employee-only coverage. That's the monthly number you're going to see in line 15. IRS uses that to determine affordability. And then you'll see that there are certain codes where you won't see it. If you're making a claim that all of your coverage was affordable to everyone, that line may be blank, and there's certain codes that do allow that to be blank, but with many other codes you will see a dollar amount there. In most cases, if you have traditional health insurance offered to your employees, you'll see a consistent number on those. It might change when you had your benefit renewal, but usually from employee to employee, that'll remain the same. If you have an independent coverage HRA, that number will vary depending on that zip code number and what the the average cost of insurance is for that employee in their zip code. That's one of the things that makes the ICHRA filings very tricky. All right, and then finally, line 16. This will show whether or not they participated in the group health plan offered by the company. If not, it'll show which affordability safe harbor complied with their offer of coverage. If it's blank, that could be of concern potentially. Something you want to look at. It may indicate that the offer was not affordable for them for that month, so definitely take a look at line 16. And to help you out as you, again, you'll have a copy of these, but to help you out as you review those forms, this is a key of what the codes mean. So a 2A would mean that the employee, let's say you had someone start in June, the first 5 months of the year would show a 2A because they were not employed in any of those months. A 2B would be if they were not yet full-time. 2C, well, what you'll see what you should see for employees who are enrolled in your health coverage. That means they did elect to be insured through the company. And then the others from there. Some other common ones will be these 2F, 2G, or 2H. Those reflect those 3 safe harbors we talked about a few minutes ago. Part 3 comes in most commonly in self-insured plans where other dependents and things like that need to be listed, as well as ICHRAs. All right, so that's 1095C. That's the form that both need to be filed and you do need to furnish to employees by March 2nd. So you'll be giving each employee an individual 1095C that, again, won't make any more sense to them than it does to us, and it's not even a part of their federal income tax filings at this time, but it's something you're required to distribute and furnish. 1094C is not furnished to employees. That is strictly filed with the government. And this is basically a summary of your AC activity over the course of the year. Part 1 has to do with the company information. Part 2 deals with if you had any other companies as part of a control group or anything like that that need to be combined. Part 3 has to do with whether or not you were compliance month by month. And Part 4 has to do with information about the aggregate group, if there is one. So some key numbers there that you'll want to match up as you're reviewing your forms. Line 18, you want to make sure that the number on line 18 matches with the number of 1095Cs that are producing and being distributed. That basically tells you how many full-time employees you had that need to be offered one of these forms. And line 20 would be if you're part of a control group or you're combining filings with multiple Fed IDs, you want to make sure that those are all aggregated and counted together for purposes of line 20. You then need to elect whether or not minimum essential coverage was offered. If not for all 12 months, which months it was and which months it wasn't. You'll also need a monthly employee count, total employee count, as well as a full-time employee count for each month. Again, if you work with a ACA or payroll provider, this should be filled out for you. You just want to verify the information. All right, so at the end of the day, success with the Affordable Care Act really boils down to maintaining accurate employee records. So as you can imagine, if you get a 226J letter from the IRS asking you about 2019, if you weren't keeping good records, it's going to be really hard to respond from an educated standpoint on that. So just really important you keep good records, hold on to those waivers, hold on to your open enrollment information, definitely hold on to your payroll records, and those things will all add up to making sure you're compliant currently, as well as if you're ever questioned that you have a chance to respond and win in that response. So just quickly, a few of the reports available to iSolved users. The first, and this is probably my favorite, is the applicable large employer compliance test. And this is just pulling from your payroll data, but what you again want to do is put in a 12-month period, and for determining, hey, do I need to be compliant with the ACA next year in 2023? You'll want to use the dates of this year, and then it breaks it down month by month Tells you how many actual full-time employees you had here, the 47, 48, 49. The hours of the non-full-time FTEs, what your FTE count is, and then the total. Goes month by month and then gives you an average. So here in our example, Jen's jam factory, their FTE count for 2019 was 53. So in 2020, they were an applicable large employer. So again, this is the applicable large employer compliance test. There's also some really great affordability tools. So again, utilizing the payroll data and the benefit data that we already have in our system, we can then run these affordability reports, as well as offers of coverage. So you can take a look at open enrollment time, use your look back period as the dates, and then it'll tell you based on their look back period status. We've got some full timers, and it'll tell you that to offer them coverage, they met the hours. Or you might see an error. So this person is listed as part-time, but based on the findings of the report, it says to verify their status. So if someone creeped over 30 hours in your measurement period, this report will let you know. And then finally, there's a report that you can run based on the lowest cost option insurance that you have in our system. And again, based on the payroll data, that will tell you whether or not your plan is affordable, and if not, to which employees it may not be. The report goes on to give you some options, how much in total between all the employees who are deemed to not be having an affordable offer, how much you would need to increase their wages to be compliant, how much you would need to subsidize their insurance to be compliant, and then if you let it ride, what the maximum potential penalty would be under the affordability guidelines. So as we said, we're going to be looking to get the forms approved by mid-January if possible. Once you've run your last payroll for the year and you're notified that your ACA forms are produced and ready for review, you'll want to log into iSolved as your client user, go to Client Management, ACA Setup, and ACA Forms Approval. From there, you'll be able to preview the report. So you'll preview each and every 1095C as well as the 1094. If everything looks good, if not, reach out to us and let us know if you have any questions. And then you'll have the option right from that screen to approve the forms. It'll have a pop-up to make sure that you are approving the forms, and then once you do, your job is done. You wait for us to produce them and send them to you, and then distribute them from there. All right, looks like we might have a couple more questions. What do we do if our electronic benefit election process does not record someone who does not take action on elections? Basically, we offer coverage and an employee does not respond and the electronic system does not record a waiver. We now do not have a waiver on file. Any suggestions in this situation? If it was recent, I'd say as recent as the current calendar year we're in, or sometime even before that, I definitely recommend getting a waiver, even if it's on paper. You can just say something like, hey, we were reviewing our records or auditing our records, or our insurance carrier was auditing our records, and they noticed they did not have a waiver on file, so they require it. And you can go directly to your health insurance carrier. They probably have a waiver that they prefer. Not that you have to use theirs, but you can get one from your carrier and just say, hey, the insurance carrier is requiring you to sign this waiver, so that they know that you are offered coverage, and that would be sufficient. That's what I would recommend doing. How do you handle when someone is FMLA? So yep, that can definitely be complex. It might be something to question to take offline, and we can talk. So when we say hours, and I probably should have clarified this before, it's hours of service that the ACA counts. So what they mean by hours of service are generally paid hours. So that can be actual time work. It can also be vacation or sick time. FMLA is a little bit different, where it's a leave, and that can affect some things. There are protections under FMLA that ban you from dropping someone from coverage while they're on FMLA. So depending on what the measurement period is, as well as several other factors, it can be complex when it comes to FMLA, and that's really a case-by-case basis, but be happy to talk about that with you offline. Is it mandatory to use the new 1095-C form for 2022? I will say whatever you're filing with the IRS, you're going to want to make sure that it's compliant with their system, especially an electronic filer. You just don't want to use something that's not going to be accepted when filed to the IRS. That's really the most important part. Yes, we are sending a copy of the slides after today's presentation. How do you code business owners, for example, a law firm who are on the insurance but not a W-2 employee? So they wouldn't be required to be furnished with a 1095-C if they're not a W-2 employee in most cases. If you were an applicable large employer in 2021 but not 2022, does the only thing that change is the reporting requirements and the requirement to offer coverage? Any requirements of a non-ALE? No, there aren't. Other than the 90-day waiting period and some of the more employment law and coverage aspects of the ACA are in effect for all employers, but in terms of IRS activity or forms that you have to furnish to employees, no. You do not have to meet those requirements. I would make sure that you file away a copy of your payroll records or your ALE report like we just reviewed, just so you can prove what your FTE number was. So in case the government says, hey, we saw them filing every year and then all of a sudden we didn't get a 1094 or 1095s for this company in 2022, you just want to be able to show, just in case you get an inquiry that you were not applicable in that year. Are there some types of companies or some types of employees who are exempt from offering health coverage? Some companies do not offer health. Well, not usually. To answer that question, if they have more than 50 FTEs, they are generally required to offer coverage. There may be some very, very limited exceptions, like there are with other aspects of the IRS, some certain municipality type things, or Native American organizations, things like that are very unique. But most privately held businesses, if not all, would be required to be compliant with the ACA in most cases. Should our waiver show the price we offer the insurance at? For instance, we currently just have all employees sign the same basic waiver that doesn't show price. We don't tell employees they qualify for a subsidized price until they have already elected the insurance at the price everyone else has offered it at. So they never really know about the subsidized price unless they elect our coverage. Then they are pleasantly surprised. Yeah, I think, to resolve disputes or resolve a really sticky situation, it would be good if in some way you can prove that a offer of coverage was made and what that offer was in terms of dollar value. Yes, that would definitely help with the back and forth. It could cause a very confusing situation where the employee says they weren't offered affordable coverage and you say they were, and it's kind of a he said, she said, where you say it was offered at this price and they say no, it was offered at a different price. So yeah, I would recommend being transparent with the cost. All right, it looks like those are all of our questions. Thank you very much. I know it's a lot of information, and certainly take a look at the slides, review them. If you have any questions, reach out to us, and just wishing you all a happy holiday and a happy ACA filing season, and I'll hand it back over to Katie.
Thanks so much, Paul. To learn more about MP's HR services for 2023 and more, I did just drop a link in the chat earlier that will connect you with an MP team member. You can also visit our website or call 774-266-6497 for even more information. Be sure to join us next week on our upcoming webinar, FMLA, Mental Health, and State Leave Programs, Key 2022 Updates. Visit our website to register and to see the full calendar of upcoming events and available resources. We will be sending out the recording of today's webinar along with the presentation slides this afternoon. Thank you so much and have a great rest of your day.